If you have some type of back, butt, hip, or sciatica pain caused by arthritis, degenerative joint, or disc disease, or facet joint problem in your lower back, then in this video, I'm going to show you the simple 4-step pain relief process that you need to follow. And we're going to dive into each of these in depth, but big picture, step one, I'm going to show you how to translate your medical diagnosis, that which is an X-ray or an MRI, into something you can better see, feel, and understand, a movement diagnosis. Step two, I believe that you can't manage what you don't measure. So in order to determine if what you're doing is working, a waste of time, or making you worse, we need to have a way to track our progress moving forward. Next, I'm going to show you how to heal by subtraction, how to do less to get better faster. The idea is pretty straightforward, and I think it makes a lot of common sense. You can do all the best treatments in the world, but if you're constantly picking the scab and or doing things, usually habits, routines, things you don't know yet, that are holding you back, then you won't allow yourself to get better. And finally, I want to show you how to use movement as medicine, not an entire sheet of exercises, but how to start with just one simple motion that will bring you the relief that you need. Now, before I dive into this, just so you know who I am, my name is Dr. Charlie Johnson. I'm a physical therapist, and my knowledge and experience places me in the top 0.5% of PTs worldwide. All right, so step one, translate. I want to teach you to take this medical diagnosis, this big, ugly, scary, kind of nasty picture here, and move it into something that makes sense to you. So it's going to be much easier for most people in this world to just fix a yucky back bend and understand that when they move a certain way, it hurts. And then, well, what can I do to improve that versus how can I fix, this joint here, or how can I widen this space, or whatever it may be. And so the entire intent of step one is to simply find a motion which, when you do it, consistently and clearly reproduces your pain, numbness, tingling, whatever you may be experiencing in the back, butt, or leg. And so what I have found after thousands of case reviews and working with many, many people all around the world is that if you have a facet joint problem, a degenerative problem, an arthritic problem, almost always, at least one of these, if not multiple or all of these motions, will be painful. So I've selected these motions because this is oftentimes how arthritis on the image shows up in your inability to move, or shows up in the form of motion, in this case, a yucky motion. So let's go through these. I want you to identify a motion that is yucky, or just record the ones that are yucky. And then I want you to record how yucky these motions are. So is it a low yucky, not too bad? Is it medium yucky, or is it high yucky? So we're going to start with a standing center back bend. So you're going to place your hands on your hips and you're going to bend straight backwards. Is it yucky? Does it reproduce your pain or problem? And if so, is it low, medium, or high? Then we're going to test the back right corner. We're going to close down on the joints and structures on the back right side of the spine by doing what I call a rotation extension test. So we're going to rotate first to the right and then bend straight back. What happens there? Then we're going to do it to the left. Rotate fully to the left, bend straight back. What happens there? Now, let's move on to the twist. Again, often painful or problematic in people who have joint irritation or arthritic issues causing their pain. So twist one time and seated to the right. There's no right or wrong way to twist to the right, by the way. Just twist in a way that you would naturally do so. Twist all the way to the right. What happens? Twist all the way to the left, just one time. See what happens. And finally, maybe you have another yucky motion. Maybe you've discovered through physical therapy, through your own motions in life, there's another motion that increases your pain or problems consistently. If so, perform that motion just one time. And then what I want you to do is record again. Is it low, medium, or high yucky? So now, chances are very, very high that you have at least one of these motions which is painful or problematic. So now, instead of having arthritis as the cause of your pain, you simply have a yucky back bend, or a yucky right trunk twist, or a yucky another motion that you picked. And that is way easier for many people to grasp, which is why we're translating it into something you can better understand, a language that just makes sense. Step two, you can't manage what you don't measure. You could get repeat x-rays and or MRIs to see every week, well, is my arthritis getting better? Is it staying the same? Is it getting worse? But that would be very costly and honestly would just be a big waste of time, and you would expose yourself to a lot of unnecessary radiation. So let's not do that. Let's instead use that which we just learned, a combination of our yucky motions, along with our pain triggers, which are things which aggravate your symptoms, certain positions or activities, to create a tracking system so that we can use some data and logic to determine if what we're doing is working, not working, or making us worse week to week. And then we make decisions based off of that to see if we need to change things or not. So this is what I call a private healing log. This is just a snapshot of something I create for people who work with me so that we can track things week to week. It's pretty straightforward, though. I would just write it down on a piece of paper or a napkin or something like that. Again, it's a combination of tracking your yucky motions, and pain triggers, activities or positions which increase your symptoms. So what I want you to do, I need you to have at least one yucky motion, at least one pain trigger. If you have 3, that's awesome. If you have 3, great, but not necessary per se. So take the motion or the motions that were yucky here. I asked you to write them down or record them, at least mentally in your brain. And then I want you to put a score next to them. So remember, I said, whenever you do the motion, if it's yucky, I want you to kind of record or keep in mind, is it low yucky, medium yucky, or high yucky? If it's low yucky, then it's a 10, 20, 30. If it's medium yucky, it's a 40, 50, or 60. And if it's a high yucky, it's 70, 80, or 90. Obviously, the higher the number, the worse the yuckiness, the pain, the problem that you experience while doing the motion. And then put a number next to it and go with just your gut instinct. Don't waste too much time trying to kind of wrestle with yourself. Was it a 50? Was it a 40? Was it this? Was it that? Just pick one. It's not a perfect science. We're just trying to become more scientific and develop some tracking system. Then take a pain trigger. Oftentimes, walking and standing are issues for people who have arthritis and degeneration because when we walk and we stand, we often increase the pressure on joints, which can be a little cranky and things like that. But it could be anything. So just record that here. And again, give it a rough number, low, medium, high, and score it. Then add up the scores and you're going to get a total like composite score, a total number here. And then what's cool about this and really powerful is that then next week, instead of making decisions based off of whether it's sunny outside or whether you're happy that morning or whether you slept well or you didn't sleep well, you're making decisions based off the number. You go back, you retest your yucky motion or your yucky motions just one time. You give them some scores. You go back and say, well, hey, I went walking this week. Well, how did it go? Is the number less? Is it more? And then again, you could add it up. So if today is, say, Tuesday or Wednesday, well, then next Tuesday or Wednesday, you go, you perform one rep one time of these yucky motions, you rescore these things, then you add it up. And if the scores are, in this case, for this example, the same, then you know that what you're doing is not working and you probably need to change something. But let's just say that the scores go down. Well, that's the name of the game. In order to win the game, you get the numbers to go as close to 0 as possible. And so if the numbers are moving the right direction, you do not change that what you're doing. You don't change your inputs because something you're doing is working, right? So that's the tracking system. We'll talk more about how we can revisit that when we go to use movement as medicine in the final part of this video. So stick around. Now that we have a tracking system, we're not treating your picture, we're treating you as a person. We can now go ahead and do less to get better faster. Everyone thinks it's really sexy to find the latest stretch or exercise or gadget on the internet to solve the problem. That's what I call healing by addition. Most people feel as though when they're doing things that they're getting closer to relief. But the best and most powerful first place to start is by healing by subtraction. Again, you can do the most perfect stretches or treatments in the world, but if you're constantly doing things which are negative inputs to the system and keeping you from getting better mentally or physically, you won't heal or you'll really struggle to heal. So there are 2 parts to healing by subtraction. Part 1, calming muddy waters and stop poking the anger bear, and then morphing motions. Let's dive into each of these. So step 1, what I need you to do if you're watching this is I need you to stop for the next 4 to 7 days, all things you are actively doing, healing by addition, all the things you're doing, such that we can see the impact of those things which you were doing. We can collect a clean baseline. The best way to calm muddy waters is to leave them alone, not for forever. And it's not because that what you're doing is good or bad or anything. All inputs are neutral until proven otherwise via the scientific process. Calm muddy waters. The next 4 to 7 days, stop. Get a baseline. You're going to notice that one of 3 things happen. Number 1, you might feel better, in which case that what you were doing, something that you were doing, was actually keeping you from healing. If you drop out that what you were doing and you feel better, then something you were doing was making you worse or holding you back. You might notice that you're the same, in which case the things you were doing were just probably a waste of time. And if you want to keep doing them and you want to waste your time, that's fine, but I'd rather not. I want results. The third possibility is that you could feel worse. And if you feel worse, it tells us that something you were doing was actually making you better. And when you dropped it out, your system responded in a negative way. So now we can go back and we can look at the things you were doing and we say, what were you doing? And start to be very scientific about testing things out to double down on that which was working. And stop poking the angry bear and or stop poking your pain, basically, is sort of similar, but a little bit different. Really what I'm referring to is both physically and psychologically, constantly checking in on your symptoms. So physically, a lot of people take their thumb, they take their fist, they take a tennis ball, a massage gun, a foam roller, they're constantly leaning up against doorways, pushing their painful area into things to see, is my pain still there? And when you're doing that, you're not only physically aggravating the tissue. Think about if you had a bruise on your arm and you were constantly poking at it, pushing on it, and or somebody was constantly punching you or thumping you on the arm. That would probably prolong the healing process. But also what it does, and this is sort of a sneaky little thing that happens, is it psychologically reinforces that you are in some way, shape, or form fearful, worried, concerned, and or not okay with your symptoms, which makes sense. Naturally, as humans, we don't want to experience pain. But the more we give attention to it, the more we fuel the symptoms long term. And we actually train our brain to experience pain long term. And this is a lot of times how people get stuck in chronic pain. So physically and mentally, let's calm muddy waters. Let's stop poking the angry bear. No more researching it. Nothing. This is all you need to start healing. The second part 2 of healing by subtraction, doing less to get better faster, is morphing motions. This is super powerful. So here's what you're going to do. You're going to take your yucky motions, or let's just say yucky motion, maybe to start. Take the yuckiest motion from step 1 here. And what you want to do is you want to ask yourself, this is a very potent question. How are these painful motions showing up in my life? Morph painful motions. We're going to take that yucky motion and morph it into life activities to help us identify things that you just don't know yet. That's the key word, yet. You'll know in a second. That aggravate your pain and keep you from healing. Then, if possible, we're going to stop these things and or tweak these things, modify these things temporarily, not for forever, such that you can stop picking the scab and find more comfort and begin to tip the scale towards healing, remove some of those negative inputs. So let me show you exactly what I mean. Chances are, again, if you have symptoms of arthritis, degenerative joint disease, facet joint problem, that you've got one of 3 or all 3 yucky back bends. Maybe not, but probably so. And so now how does this back bend show up in life? It shows up in very predictable ways. This is pretty clear. Look, if I take this back bend, if I take me and I twist myself and I put myself on my belly, what does it look like? It looks sort of like this. So maybe you have a degenerative disc problem and you've been told that you should do this exercise, or this is a classic exercise just in general. It also looks like a yoga exercise called a cobra. And so yoga is good for back pain, right? Well, maybe, but if you have a yucky back bend, then this is just going to have you going into yucky motion over and over again. Is that something you really want to do if you want to feel better? Probably not. So we could stop that, for example. Laying on your belly, probably also painful because it's going to put you in a little bit of a sway back. Standing and walking. Remember, I referred to the pain triggers. Standing and walking. These things will almost always be painful and problematic if you have a yucky back bend, because walking is a back bend. As you kick your leg back, as you push off, you see that it puts your back in a little bit more of an arch. It moves you closer towards the back bend. Laying on your belly. Maybe you read or write or play games or do whatever you do on your belly. If that's the case, that might be an issue. Standing is often problematic because a lot of people notice that they stand with an excessive arch in their lower back. There's nothing wrong with having an arch in your lower back, but if you have a yucky back bend, then it's going to hurt. And so why not try to tuck your pelvis? Take some of the strain off your lower back. Same with walking. You can shorten your stride. Try walking faster. That'll naturally shorten the amount that you kick back in most cases. Try again tucking the pelvis such you round the lower back a bit and remove some of this sway back. Sitting up tall is the last thing you're going to want to do because it puts you into an arch in your lower back, a back bend. That is your yucky back bend showing up in sitting, in this case with good posture. There is no such thing as a good posture. In this case, the best posture is the next posture. The next posture should be you just slouching, putting your back against the chair and allowing yourself to just relax. Now, let's just say a back bend wasn't the problem. Maybe you had a yucky twist. How does a twist show up? If you sleep like this with your leg up, that's going to put a little bit of a torsion in the pelvis. Maybe you've been told that you should do trunk rotations in physical therapy. Well, maybe, but in this case, your legs are dropping to the right, your trunk is twisted to the left. So this is a yucky left twist. If you have a yucky left twist, then this is putting you in that position over and over and over again. Maybe you're seated and you work at a desk and you're constantly rotating your spine or your trunk one way versus the other to reach for something or to perform some task or duty. Be aware of that. Maybe you're paying to be put into your yucky motion over and over again. In this case, maybe forcefully so. Is that something you really want to do? Pilates, good for your core, good for your back. Well, in this case, not so. This is a twist to the left. And remember earlier how I alluded to the power of translating your medical diagnosis into a movement diagnosis. If we can fix this yucky back bend, let's just say, and we can fix a yucky twist, then we can fix your ability to get back to life. And you can see here sports like pickleball, golf, tennis, all those things involve different types of twisting maneuvers and back bends as well in many cases, especially if you're overhead serving. That's a back bend. In this case, until you free up the back bend, until you free up the yucky twist and you make it yummy again, you're not going to be able to get back to this. Hopefully it helps you connect the dots. And again, maybe you have another yucky motion, which you know is painful or problematic. Just start to ask yourself, how is that yucky thing showing up in my life in ways I don't know yet? Start to brainstorm some ideas and comment below if you need some help doing so. Now, final step. We put this little dude or dudette on a diet. Now, we unload the pain side of the scale and we start to naturally tip it towards healing, the final part of the process. So we're here now. We don't have to work as hard to overcome all those yucky inputs, and we can simply use movement as medicine now moving forward. So again, we're not talking a sheet of exercises here. By this point, usually just one motion is enough to tip people fully towards healing. And the goal of taking any medicine is to never take more than needed, is to take as little as necessary. So you take as much as needed, as little as necessary to get the benefit that you're looking for. So let's talk about where you can begin. There's many different ways that you can begin using movement as medicine, but I'm going to give you a rough starting point to shift you in the right direction. So what I want you to do is I want you to go through each of these motions one rep, one time. And you've already gone through maybe some of them. So if you remember the outcome of doing them, the twist and the back bend, awesome. But here's the gist. You're going to twist one time to the right, one time to the left. Any of the motions that you're going to perform here in a second that are yucky, cross them off. We are not going to use them as exercise or movement as medicine. The chance that you're going to do yucky things over and over again and get the result that you want, feeling better, is not very high. Twist one time right, one time left. If either of them are yucky, cross it off. If one of them is yummy, it could still potentially help you. Then pull your right knee to your chest, pull your left knee to your chest. Cross off if any are yucky. Right figure four, left figure four. Right leg raise. This is the end position. Start with your heel flat on the ground, your knee straight. Raise the leg up on the right side. Then leg straight on the left side, heel flat on the floor, raise it up on the left side. Now we're going to do a seated forward bend as if you're trying to palm the floor. Maybe you can't get all the way down. That is fine. Put a yoga block there, a stack of books or an Amazon box or something there. And then standing back bend, bend straight backwards. Again, any yuckies, cross them off. They are not options to begin with. We're not going to use yucky pills as medicine. Now, there are a couple ways we can start. We could simply just pick the yummiest, the best feeling. I don't care if it was on the right side or the left side, the best feeling motion, and begin with that. But oftentimes, people with arthritis will respond best to a couple motions. And the first motion that most people would respond to if they have arthritis or degeneration as a cause of their pain would be some type of yummy twist or yummy forward bend. And basically, this is just the idea of what I call the law of opposites. So because a lot of people with arthritis have a yucky back bend, what is the opposite of a yucky back bend? Well, the opposite of yucky and or something that makes you worse is something that feels good and something that makes you feel better. And the opposite of moving backwards is moving forwards. So just like righty tighty, lefty loosey, if turning the screw to the right doesn't work and you want it to be loose, then you turn to the left. The opposite input often yields the opposite result. In this case, what you want, which is to feel better. So if bending backwards is yucky, many times bending forward will feel yummy. So was that a yummy motion for you? If so, awesome. If it wasn't, that's okay. And by the way, if it was a motion that felt good, then I would say 3 30-second holds 4 times a day as needed. This is the prescription. But maybe that wasn't yummy, and or maybe there was some issue with it for whatever reason. Twist. You can also apply this law of opposites to the twist. Let's just say you have pain on your right side and the right twist was yucky. Oftentimes the right twist is yucky or one side twist is yucky. The opposite is yummy and feels good. So why not twist to the good, safe side repeatedly? 2 sets of 20 reps, 2 times a day as needed. We'll talk about what this means in a second. So the law of opposites. If twisting right equals yucky, then the opposite of yucky is yummy and the opposite of right is left. Now, maybe neither of those work. They're all yucky, Charlie. I can't do them. That's fine. Maybe you had a knee to chest that worked for you. Don't pick both sides. Pick one side. I don't care if your symptoms are on your right and the left knee to chest feels best. Maybe your symptoms are on your right and the right knee to chest feels best. It doesn't really matter. Just pick a yummy motion. Try to get out of your own way and stop overthinking it. 3 30-second holds 3 times a day as needed if you want to perform one of these or you found that this felt best. Maybe it was figure 4 that felt the best. So you would sit in this position, lean slightly forward, feel a little pull in the buttock, 3 30-second holds 3 times a day as needed. Same prescription. Maybe one of the leg raises was best. 2 times 15 reps, 3 times a day as needed. We already went over this one. Now let's just say you're one of those people that for whatever reason a back bend is not painful. That's fine too. It's all good. 1 set of 10 reps 4 times a day if this was the yummiest motion. That's how you would take it as medicine. Now notice I said as needed. Take the movement as medicine. In other words, take the movement at a time that makes most sense. So if you wake up first thing in the morning, you're good when your eyeballs pop open, but the first few steps out of bed are painful, sit on the edge of your bed and perform the twist. Take the movement just before you know something's going to be yucky. Maybe you know that after sitting for a while and going to stand is really problematic. Perform your yummy motion right before you go to stand. Maybe your pain is worse in the afternoon. Do several sets of your motion as medicine closer towards the afternoon, not first thing in the morning. So the timing is very important, just like it is with other medications. Now, you're going to take that yummy motion, the yummiest motion. You can start with this law of opposites idea or just pick one. Literally, it can be that simple. Just pick one and pick one side. That's all. You're going to perform it for the next 7 days. And then what you're going to do is you're going to come back and you're going to retest your yucky motions just one time and rescore your pain triggers. So you've been doing this motion for a week. By the way, stop at any point if the motion becomes yucky or makes you worse for some weird reason or something funky happens. That's fine. You can stop and we can find another motion. Otherwise, do the motion as prescribed, given the prescription I just showed you, every day for 7 days. Rescore your yucky motion, rescore your pain triggers, and add it up. If you are moving in the right direction, meaning your trend is better and the scores are going down, then you do not move on to another exercise. You do not add on or add in another medicine. Do not do it. Stick with that which is working and stay scientific. Stay grounded in the logic, not the emotion of wanting to do more to get better faster. You'll goof it up almost every time. Okay, so there it is, the 4-step pain relief process that I recommend you use if you have some type of arthritic problem causing you a pain in the back, butt, or leg. Let me know your thoughts below. Was this helpful? What did you find as you went throughout this process? And then if you're interested in learning how to naturally solve this problem and you want more information, go ahead and be sure to check out my other videos on this topic. Thanks so much. Chat soon.